May no one be separated from their happiness. May everyone have equanimity, free from hatred and attachment. Thank you for being here as a part of this journey. I'm delighted to welcome my guest, our guest, for this introductory session, Dr. Sudhir Khandelwal. He's a very dear friend and who's held my hand through many a dark night of the soul. He's a former professor and head of the Department of Psychiatry at the All India Institute of Medical Sciences. He's a former chairperson of the Global Network for Mental and Neurological Health Research. He's published more than 140 papers. And he has worked for several years at a time in diverse cultures in Ethiopia, rural Nepal, and the UK, where he completed his MD in psychiatry from the and PGI and MRC from the Royal College of Psychiatrists in London. And he even spent 5 months in Antarctica with the Indian expedition there. And we will get into this as part of our conversation today as to who makes for a quintessential psychiatrist, what are the qualities that we should be looking for as we surrender to them. But first, a few introductory comments of the larger aspirations of our initiative. We sent out a questionnaire to our constituency and are working to devise this based on your feedback. And we were deeply encouraged that we received these from people aged between 18 and 81 from the diversity of India and countries such as Canada, Sweden, Taiwan, Israel, and South Africa. And so we will be working to retune our schedules based on the convenience for most people. An overwhelming number of respondents wanted the sessions to be interactive, but almost equally you wanted them to honor your anonymity. And so we're trying to strategize this balance. And on this issue and everything else that we would like to do, please feel free to send us your comments in the chat box as to how we can more pointedly respond to what will be useful. And that really is our guiding principle. And you had also wanted us to explore alternative approaches to healing, religious, spiritual traditions, and psychology. And we're equally divided between weekly, fortnightly, or monthly sessions. So we pretty much decided that we will follow the middle path and meet on alternative Fridays. And the most common challenges, and we will not limit ourselves to these as the sessions unfold, were uncertainty, fear, loneliness, depression, and grief. So as we go along, we will explore the different traditions and how they understand and help heal our minds, and more pointedly respond to your questions in ways that we can preserve anonymity, because that seemed to be a very emphatic suggestion. And so next week, we will feature Professor Hani Oberoi, one of the few fully accredited psychoanalysts in India. We are looking for we will be looking to support from a senior Tibetan Lama, an iconic homeopath, somebody who specializes in yoga therapy, a monk from the Ramakrishna Mission, a representative, the head of the Dargah in Ajmer Sharif, who will share Sufi perspectives, a doctor from the Tibetan Institute of Medical and Natural Sciences in Dharamsala, somebody from the Aryaveda in Kottakkal for Ayurvedic approaches. And I'm not sure yet if it will be appropriate, but perhaps the head of the Department of Medical Astrology from Banaras Hindu University. And we're looking to Dr. Khandelwal in this introductory session to first help us understand what is mental health, what is normal, what is it to be mentally ill? When do we need to do something about it? When do we need help, outside help, professional help? And what are the approaches, treatment approaches in Western therapies? So, we want to start with this. And so let me pose to you, Dr. Khandelwal, what is mental health? What is normal? And what is mental ill health? When do we, can we believe that we have a problem that needs help?
Okay, namaskar, Rajiv, and namaskar to all your audience here who have come to listen to this series of healing of mind. First of all, I also thank you for making me the opening batsman for this series, and I'm seeing that you have a list of very luminary speakers, and I'm glad that you made me the first speaker, because after their communications on this forum, I think I would have felt very awkward and very small. So since this is about healing of mind, we must we spend few minutes about the mind and its functions, all right? And that's your question, is that what is mental health? Mental health has been defined in various ways, but one of the most universal definitions which we use is the one given by the World Health Organization. It has got certain characteristics, that is a state of mental well-being, which means that it gives us the ability and capacity to act, to think rationally, to behave properly, and in a way which is meaningful and fruitful to us and to people around us. And we also contribute to the development of the society or the nation. So this is in essential the major characteristic of good mental health. When these functions get disturbed, then we say that a person is having impaired mental health. And your question was that when such a person seeks help, in our course of daily living, we sometimes feel that at times we are not acting properly, we are not thinking rationally, our decision making has been affected, and we feel incapacitated. So but we snap out of it, because we have that kind of resilience in all of us. Over the years, we develop that through our experiences and through our development and upbringing. But sometimes any such situation can be very overwhelming, and we find that in spite of our efforts, our functioning is getting impaired and impaired further. So when one of these functions of thought, emotions, acting properly, or cognitive abilities, that gets impaired, and it also affects our functioning, producing disability, then we think that the person is now mentally ill and may seek some professional help.
But isn't this very much also a socio-cultural thing? That, for example, I was just sort of searching, going through the net, and I think sort of the Western view of mental health is, one of the yardsticks is that if you're grieving or if you have a problem for 15 days, then you're ill, you have a problem, and that you should seek help. So in many ways, this is relative for different people, and you use the word resilience, and so different contexts we will feel incapacitated to different degrees, and our self-confidence in our ability to overcome it and move on is surely a factor in this. And yet, ironically, that in the diagnosis of mental health, in most traditions, including Western medicine, is that there is no real empirical basis. An experienced psychiatrist, such as you, will probably pick up the cues faster. And very often you hear of people who have been misdiagnosed, and if it's a serious illness, because you don't have the empirical correlatives, such as you can't go into the brain and figure out if there is a malfunction, and so we will treat him. So there is a very strong subjective element in the very nature of mental health. And so is there something else that we should be looking out? For example, during COVID, many of us are living with challenges with sleep or with anxiety, and we're just living with it, and life goes on. And when does that anxiety become a problem for us to be able to seek help and to identify it as a real problem? Because we're isolated, we're locked in, and we don't really know when to push the button and which button to push.
Yes. Very true. In fact, the problem with the modern medicine, especially in relation to psychiatry, is that we do not have many times very objective evidence to show that here your brain has been malfunctioning, especially for disorders like anxiety and depression, which you named. And so when we say that this is out of the ordinary, for example, when we are talking about hypertension, we may not show any evidence in our lab parameters. But the statistically, we see that this particular range of blood pressure is normal, and at this time it becomes hypertension. The same is true for diabetes mellitus. In the initial stages, diabetes mellitus may not show any evidence other than the impaired blood sugar level in our bloodstream. So we say that this is a diabetes mellitus, but we do not have that kind of objective parameter for mental disorders. So whatever the diagnostic characteristics are there in the Western medicine or in the classificatory systems of psychiatry, they are on the basis of certain studies which have been done, and some empirical basis has been formed that after so many days, if a person does not come back to a normal state of mental health, then this would be considered as a sign or as a feature of anxiety or depression. So for many such disorders, a time frame has been given. But you are right to say that sometimes even grief, which is a normal experience in our daily living, or a traumatic event, or loss of something, maybe finance or of a loved one, or of one's self-esteem, sometimes that also impacts our well-being, mental well-being. And then it becomes difficult to say that whether this person is mentally ill or he is going through a normal vicissitude of life. So there one needs to see that if it has gone on for a length of time in which the disability has been such that which is making person dysfunctional, then we would say that yes, this person needs help.
Also in Western psychiatry, the whole aspect of the biochemistry of the brain, and so how do you begin to draw this connection between mind and brain? And as you go into the more subtle aspects of one's mental health and the variety of disorders, some of them which may be more serious, like schizophrenia or bipolar, disorder. So when do you begin to feel that you're a psychiatrist, and when do you begin to feel how and when and what kind of interventions may be appropriate, and what are the range of interventions that are available in Western medicine? And I mean that, in terms of pharmacology, in terms of psychoanalysis, in terms of counselors. There's the whole range of possible interventions that are available. And so what is the first call that a person makes when they're struggling? What are the community resources that may be available in terms of family and friends? And so what is kind of route, the progression to complexity that you go out and when you reach out to a psychiatrist or whoever you're reaching out to?
Okay, Rajiv, I would like to emphasize on two things. One is about the development in the neurosciences in last 2-3 decades. And secondly, about the biopsycho-social model. In last 3 decades, the neurosciences has made very exponential progress in terms of investigations. And now we have got the understanding of the brain, which was not available earlier. We have got very sophisticated investigative tool. Though they are still research tool, they have not come to the level of everyday lab investigations. But now we know a lot more about the brain compared to the earlier times. But even what we know at this time is very minuscule as compared to the very complex nature and functioning of brain is concerned. But we know that what goes wrong in a particular disorder or in a very subset of patients of that particular disorder. So one finding may not be applicable to all the patients of that particular diagnostic category. But neurosciences and the progress in the field of genetics is likely to show more light in next few years. Secondly, we explain most of the psychiatric or mental health disturbances on biopsychosocial model. We believe that there are biological factors by way of genetics, by way of our neurotransmitters, or by way of our structure of the brain. These are biological and parameters. And then there are very important social factors and very important psychological factors. Psychological factor means that the early development in childhood, the preschool period, schooling, adolescent, adult life, that means the entire life course of the individual. So these are very important aspects or dimensions of mental health. So whenever a person, we feel that this person is now perhaps requires some professional help, so the help has to depend or must take into account all the three dimensions, that is biological, psychological, and social. So there would be role for all the three. So even when a psychiatrist chooses to give some medication to a patient, for example, in anxiety or depression, can't ignore the contribution of the psychological factors or social factors, because they also contribute not only in the manifestation of a problem, but they are also very crucial in providing succor or relief from the given situation. So all the three dimensions will be very important, and a judicious mental health professional will make use of all the three dimensions.
But what are the, in this matrix, what are the respective roles of the different systems of treatment that Western medicine offers? And I'm looking for some sort of identification. When do you go to a counselor? When do you go to a psychiatrist? When do you go to a clinical psychologist? There is such a huge range of people and specialists who are available. And I hasten to add that in psychiatry, which is your profession, is that there are, in all of India, there are just about 9,000-10,000 psychiatrists, maybe even less, for a population of 1.3 billion. And so a common predicament for people is, what do I do next? Either for oneself or someone who is suffering and reluctant to seek help? Or where do I go? Who do I go to? So, for advice.
Okay. Let me very broadly classify mental disorders into two kinds. The common mental health problems and the severe mental illnesses. So common mental health problems will be like mild to moderate depressions, anxiety disorders, some kind of phobias, people become afraid of certain situations, or day-to-day stresses. The person does not need to seek any mental health professional. Many times, the social interventions, for example, talking to a friend, talking to somebody who is senior to us, that takes care of the problems. Or even sometimes just letting it pass for a few days, and the person's resilience brings him back. He rebounds. But when we are talking about the severe mental illnesses, like you mentioned, two categories here, schizophrenia and bipolar disorders. These are the disorders which need a specialist's help. That means psychiatrists, because there would be a very important role for drugs, and that also will incorporate psychosocial factors. That means the psychological support and the social issues which may be complicating the manifestation or the prognosis and the recovery of such an individual. So in severe mental illnesses, the call would be a psychiatrist, because this person may require medication, may require hospitalization, and longish kind of treatment. But for many other problems, one doesn't need a specialist psychiatrist. And even our counselor, they are doing good job, clinical psychologists, or even the family physician or elderly person within the family or the community, or even religious leaders. They all can provide adequate support and care.
I have a question from a very iconic lady from South Africa, Ila Gandhi. And she said, I've come across a child who was not able to adjust to school discipline in the beginning, and doctors suggested that she go on medication. The parents resisted and instead gave her a space to express herself and work at her own pace. Last year, she eventually completed her matriculation examination and scored the highest marks in the province. How does one explain this?
Given a single case, it is difficult, because we do not know all the details of this particular child. But many times the early childhood problems, the children simply outgrow them. And maybe that at that time, the mental health professional thought of medication, but it was good that the parents decided otherwise. And with the support of the parents, of the environment, of the school, and child's own whatever genetic inheritance, the child outgrew and ultimately made a very successful academic, like you said, that topped in the matriculation. So all these kind of things do happen. Yes.
Not to dwell unduly on this and move on, but I think that I'm getting this on the chat box and in many of the questions, that there is a certain fear and a certain skepticism of the purely pharmacological process. And this seems to be grounded in a lot of experience with the actual practice of modern psychiatry. And I ask this question of you in particular because you're someone I admire greatly. And I believe that anybody who has been through the medical training ground of the All India Institute of Medical Sciences, in terms of motivation, in terms of the sheer number of patients that you see, and I mean, I would say less greed than what private hospitals have to offer. And so we have somebody's posted here as to we went to see a psychiatrist at a very well-known hospital, and before he could even finish recounting his symptoms, in the 2-3 minutes, there was a prescription on hand with two salts, two medicines that he should take. So this sort of in a world of instant solutions and instant gratification, perhaps the abuse and the limitations of pharmacology, and how does one sort of address this, and how does one cope with this? And I mean, this is of course this is an aspect that is fairly widespread across the skepticism about modern medicine and big hospitals. But in psychiatry, where, as we have just discussed, that the very diagnosis is somewhat tentative, as a patient or as a caregiver, what does one do?
Like you said, Rajiv, that India still is very much incapacitated by the number of mental health professionals. Our number of psychiatrists in India for a population of 130 crores is very minuscule, and the same is true for clinical psychologists and trained psychiatric nurses. So I agree that it is becoming a very common practice for psychiatrists sitting in a busy outpatient clinic of a hospital to immediately write a prescription of some medication. This is happening, and I admit this. The problem is that the workload of a psychiatrist in a hospital has increased so much that the prescription comes very easy to his or her mind, because writing a prescription which has only drugs, for example, it takes me not more than a minute to write 2, 3, 4 drugs. But if I wish to help the person sitting in front of me through psychological means, I need at least half an hour to explore and to advise, and one session may not be enough. So most of the psychiatrists they do not find time, or they do not find it very gratifying to spend half an hour on each patient, when in this half an hour they can perhaps see 5, 6 cases. And though in government hospitals it's different, but in private setting, it means that each new patient or a follow-up patient brings in more revenue for the psychiatrist, for the hospital. So it's a very complex situation now.
Well, thank you very much for your candor. We were locating this discussion in the context of starting it in the context of COVID and its impact on mental health. And the data, some of the data that I was looking at is quite fearful, even for normal times, where we're now talking about 25% of the population who needs mental health at some point in their lives. And this data has gone up hugely in COVID. And it's not just because of COVID as a disease, because someone has just asked the question that is there a correlation, a scientific correlation between COVID and mental health? And I think they're asking if there's a purely clinical correlation. But certainly in terms of the experiential aspect. So we had one day in 2020, I forget, maybe it was a 20-something in May, where 1.3 billion people suddenly went into lockdown. Which meant that all the social, psycho-social, the phrase that you used, parameters that nurtured normalcy were plucked away. And then you also have not just what is going on during COVID, but also post-COVID for the thousands of, hundreds of thousands of adolescents who have been denied their processing of growing up and developing and nurturing emotional intelligence. So I raise this as much by way of consolation that for those of us who are struggling with these, to know that this is not unique to us and we're not alone. So what has been your experience as a treating psychiatrist? What are the kinds of ailments are people coming up with? What does the data tell us about the extent of the problem and how can we begin to address this?
Rajiv, one thing which this pandemic focused our attention, that means of the scientists and the doctors and the perhaps planners and the policy makers, is that this COVID pandemic, it brought another pandemic, and that's why it is called syndemic. That means that before this became a full-fledged pandemic, the WHO had made prediction that the mental health epidemic would also begin very soon, and it did happen. That along with the COVID pandemic, what we are seeing is the mental health pandemic, and it is all over the globe. It is not confined to us. Though how each society or a country handled this pandemic, it has varied from culture to culture or from nation to nation. But India, like you said, in the last week of March 2020, made one of the stricter lockdown in the world, and but other countries also followed the same suit because we did not know how to handle this. And what has been seen is that our response and the consequences of pandemic has been largely governed by our social determinants. So that means that the country where the social and health indices were already poor, they faced the severe brunt. And when I say about the social determinants in health or mental health, I mean that the income and social situation or the problems, education or the literacy in the society, job security or unemployment, working uh, working life conditions, food insecurity or food security, housing and living environment, early childhood adverse events, social inclusion or discrimination, and about the conflict and access to health services. These are all these social determinants which determined our response to this COVID pandemic. And what we are seeing is that in India, this pandemic, it increased this inequality. And that has led to a lot of mental health disturbances. What has been seen is that the societies where the lockdown was strict and where the COVID infection was rampant, they had more mental health disturbances. It is now the clinical experience as well as scientific studies which have been published in prestigious journals like Lancet or JAMA. They have shown that in a 1 year follow-up or 6 months follow-up, the number of people who came to the attention of a medical expert for help, they were suffering from stress, anxiety, and depression. These were the three major problems which these people suffered.
Sorry to interrupt, but while this is true and it helps to get a larger picture, but in terms of in many ways, the catalyst for this series and for all of us is that what can we do about it? This is a macro picture. It is related to public policy, to pre-existing parameters, and medical literature may describe it as mental disturbances, but for us, it's living hell. And so, in that context, as the community who are victims of this, what can we do? How do we deal with this unfolding before us and with no end in sight? And as our questionnaire suggested, that people are mostly dealing with fear, loneliness, depression, grief, both for themselves and, as the questioner has just asked, also their caregivers. And other than looking for someone to give them a Prozac, or I don't know what the current fashionable pill is, I mean, what can we do when the
Yes. So, Rajiv, I think it must work at three levels. One is the personal, one, the second is the social, and the third is the at the national level. I will come to the national level first. Uh, though the mental health burden on the in any given nation has been increasing year after year, and now depression occupies the second place as far as the global burden of disease is concerned. That means the depression is the second most disabling condition after cardiovascular illnesses. That is one. Second is that this is a kind of uh, uh, time bomb on which we are sitting, and the developing countries are ill-equipped to deal with this situation, because, as you said, that the number of mental health professional or the mental health services are far inadequate. This is a second aspect. And yet the the there is no blueprint in front of us by which we are ready to take on to this increasing burden of mental health disturbances. But the COVID pandemic has brought this attention like never before, that the mental health of citizens is important, and where people had better mental well-being, people had resilience, then the mental health consequences of COVID was less. So the nations, it will be a long-term plan where nations will have to take care of the social and cultural determinants I was talking about. That means the social indices and the health indices. Because without this solid background or the foundation, I think we will all be struggling all the time.
But I think the issue that's coming up again as a citizen is that while we're talking about it coming to the attention well, I don't know what, I think you probably mean central government, and and yet in terms of national policy, the most dominant concern that people had was a sense of uncertainty. And surely that the state is perpetuating uncertainty by its ambiguity. And communications are contradictory, it's confusing. So before even getting into this larger matrix of public policy, I mean, there seems to be a complete lack of concern for the citizen. So if we are preaching wear a mask, but our leadership does not wear masks. We all know people who have died due to shortage of oxygen, but there are no deaths due to shortage of oxygen. And there is a global consensus that what we need are boosters, but we are giving whatever it is, restorative injections. So I think this ambiguity that surrounds and overwhelms us is a very crucial factor in uncertainty. And I think public policy is also tending to look at how to heal. But I think that we have to look at it. What are the qualities in public policy and as it manifests in education and healthcare that will give us a feeling of confidence or something to hold on to.
Let's hope, Rajiv, it happens that way once we are through this with this pandemic. So that is at the national level, and it's a very large canvas we are talking about. The second is at the societal level. What is happening within family, that the kind of support family is providing to an individual, or the family members are providing to each other. So that will be a very important role where family would be playing, and also of the social neighborhood, that what kind of cohesiveness is there within the society, where people feel for others and they provide all the requisite help. And the last but not the least will be the role of the individual himself to deal with the all the issues which you talked about, lockdown, loneliness, uncertainty, and the future issues of maybe helplessness or sometimes hopelessness. So that will be in all the dimensions. That means the personal, family, social, and of course, national level. So that would be.
No, I can't help but just sort of, point to there is the famous Israeli philosopher Yuval Harari, and he is really arguing that we will have to train ourselves or retrain ourselves to live with uncertainty, and that we can now expect, in a lifetime, that the average person will have to change careers in anything between 3 to 5 times. If we are looking at social relationships, that people will have, an average of 2 to 3 partners, and not spouse. And so I'm really pointing to and trying to understand that in this very complex evolutionary process, where there is a complete dissonance in terms of our respective realities, in terms of public policy, that what advice as a psychiatrist beyond intervention and pharmacology and talking, and we can't wait for society to change, or for the person who is really suffering. So with all the suffering that you see, and the thousands, hundreds of thousands of patients that you have treated, what is it that gives you sort of, hope or confidence that things might yet get better, both as determinants of what leads to mental health crises and our ability to address them? And is it a failure of the system that we find such an overwhelming number of people who are saying to each other that, look, I mean, we have to be looking at alternative systems, we have to be looking at religion, we have to be looking at spirituality, because the dominant system of medicine does not even have a policy for the rational use of drugs. That's another question that has just popped up. And I mean, I know that you have found your how do I put it, your sanity in some ways by going off on long hikes and other things that you do in your life that give you the patience and the compassion to deal patiently with so many people who are suffering. So what would you say to somebody who comes in and is completely distraught with the larger predicament that we confront, and not just his own particular illness, but we're all, this is what COVID is showing us, that we're all a part of this community that is struggling and suffering, dealing with our minds?
There is always hope for the future, Raji, that this pandemic will open new vistas for betterment of the society. So let's have that hope in our mind, though we are not seeing yet any green shoots of that particular hope. But we always it's better to have that kind of hope. Now, coming to an individual, I think the focus which you have mentioned about uncertainty, that it has brought this aspect like never before, that things can become so uncertain and things can go wrong for no fault of yours. And things can go in a direction which we never anticipated. And that's what this pandemic also brought in our midst. At individual level, if one has to help oneself, Then there are various things where this person must do to help himself or herself. And that is by having a good lifestyle. And this lifestyle will see him or her through. And there are things that what can be done or should be done to have a good lifestyle. So I think that the focus for lifestyle will go a long way, and that has also been shown here. That in otherwise also in the health, what we are seeing in all over the world, that the lifestyle disorders are becoming more and more common. Most of our disorders now, which are causing a lot of health burden, they are all non-communicable diseases or lifestyle disorders, like anxiety, depression, cardiovascular illnesses, or even cancer, or drug and alcohol problems. So one will have to work on improving one's lifestyle to have a basic better health, so that in situations like this, one is better equipped to deal with this situation.
Just a quick question to take you back a little bit, because this has been popping up on our chat box. Is the imperative for everybody to have, for every country, every community, to have a policy for rational drug use? Even during COVID, we have seen the arbitrariness of pharmacological protocols and the manner in which these have been implemented. So what is the basis of a rational drug policy, and how can we work towards that?
Rajiv, a lot of work has been done in this area, rational use of drugs and rational use of psychotropic drugs. But most of the time, it has not gone beyond listing of certain drugs for particular disorder. So the rational use will be that particular condition and what kind of drugs, in what doses, what duration, when to give, when not to give, what are the contraindications, all those kind of things. But no document has come out of, at least in India, which has talked about all that, other than the textbook of pharmacology. So what we have is the rational use of drugs is basically the conditions and the list of drugs for each condition. But the detailed pragmatic or the practical aspects of use, that has not yet been available, especially in our country. We all know that what drugs to use. We have all read from our pharmacological textbooks. We have all grown through our experiences. But as a way of some document, there is no comprehensive document which can throw light on this. It is only through the constant updating oneself through scientific publications.
You did flag lifestyle, and it would be useful coming from a mental health professional like you, that conventional wisdom, and please add to this, says that it's very important to do exercises, because exercises release endorphins. Apart from what it may do for your weight and otherwise, the importance of community, fostering community, and that we should also be looking at community-based solutions to our mental problems. So in terms of what are the healthy mental health habits that you might point us to, that will help us in this time?
Okay, I will begin with our sleep. Sleep is one of the very important dimension of our lifestyle. What we are seeing now is that the young generation, their sleeping time is at 4 a.m. in the morning, and their waking up time is 2 p.m. in the afternoon. So which is very unhealthy, and it has all the biological consequences. It is not just a matter of discipline, but it leads to a lot of biological disturbances within the system, because this is not according to our biological clock or our circadian rhythms. That is one. Secondly, about our food habits. What we have seen is that in India, the overweight and obesity has been growing every year. And even at this time, according to the recent National Family Health Survey, about more than 40% of our young population, that means between the age of 15 to 34, is already overweight or obese. So that is very unhealthy, and our food practices are they need looking after. So that is also a lifestyle. Third thing is the screen time. A lot of young people are, one is because of the necessity of working on the computers, but also because of their being busy in the social networking sites or using the net for all unnecessary kind of information. So the very indisciplined screen time has led to a lot of problems. So the screen time has to be very judiciously used. Fourth is that the what you mentioned as the exercises, which would include physical exercise, yoga, pranayam. And what has been seen that these practices, they have very beneficial effect on our, not only on physical health, but also on our mental health. And all the big institutions, they have done studies on this to show the beneficial effect on conditions like anxiety and depression. Then is our social connectedness, that how well we are socially connected, whether we are taking help from the society or we are providing help to the society. And also a very long study done at the Harvard about that what makes a happy or healthy life, found that the major factor which worked in people who remained, who enjoyed longevity or who enjoyed good health, was this social connectedness. And finally, the spirituality, that how well you conduct your life, your compassion, gratitude, your forgiveness, your helping others, your generosity. So all these are part of our lifestyle, which will not only improve number of our ways, but also our resilience in face of any adversity like this. So a lot of efforts have to be made by an individual to improve on one's lifestyle, not for the only for the current times, but also for the future, because very uncertain times we have now.
It's interesting that you did mention spiritual, you did talk about compassion and these sort of personal aspirational values. But I think there are also societal imperatives that are creating this sense of fear and uncertainty. And we had, a question that said, someone who said, look, I feel extremely uncertain and anxious because of the state of Indian democracy, or what is happening in the larger canvas of India, which makes us feel insecure and uncertain about our personal futures. So, for example, whether you are a majority community that ostensibly fears the growth of the minority community, or you are the minority community that is anxious about what majoritarianism is doing in India or in many parts of the world. So there is this whole canvas of elements. And I think that in the discourse and in terms of public policy or in terms of efforts to try and ease this, a little conscious effort is being made at the role of the community, of community building, of finding community solutions. And this is a point that Ila Gandhiji made when she wrote into us earlier, is that what are the potential community responses? And this is where the nurturing of compassion and to use again the vocabulary of Western science, because this is the parameter of this program, and we will perhaps dwell on it when we move to the other traditions, was that it is this strong sense of self-centeredness, of the I, me, mine, that experiences the suffering. And so today, Western psychology and psychiatrists are telling us that people who come into them with psychiatric problems have a great obsession with themselves, of the I, me, and mine. And so in times of COVID, people who are outer directed and are reaching out to help other people have less trauma and suffering. And apparently that's also borne out by some elements of neurobiology that suggests that being outer directed. And so that really is, this is to try and answer briefly within the context of this program, the overwhelming flagging of loneliness, fear, and sleeplessness is another very important factor that has been raised, because all these things, how do you declutter the mind, is another question. And I think that increasingly, and I just want your sense of what the value of alternative approaches, given the, in a sense, the lack of empiricism in Western medicine itself in dealing with the mind. And then, that tends to sit on judgment on the alternative approaches. And I know the other day I was looking at, the Food and Drugs Administration, their protocols, and they're not quite yet ready to, admit that meditation, for example, can have a serious beneficial effect. So there's almost polarization. We're living in a polarized world in every which way, whether it is politically, whether it is systems of medicine, whether it is communities. So as someone who has engaged in it so intimately, what is your own take on alternative approaches to healing? And very often they're held out to be as being very risky because they're not Western, or they're not Western science, and so they may be exploitive or what have you. But I think we've seen, and I'm really grateful for your candor in acknowledging the limits of Western medicine, as I'm sure there are of the other systems. But how do you see the relationship, and what elements in the alternative approaches that do you particularly value and celebrate?
If you're asking my personal opinion, then I would value the practice in which I always advise patients or even other people who come to me for advice, is about the use of yoga, meditation, and pranayama. That is my very constant advice, because I have found and I have studied, and the evidence is available in the scientific publications, which have brought out very clearly the beneficial effect of these 3-4 practices, including physical exercises. So I am a very strong proponent of this, that people must make physical exercise, yoga, meditation, pranayama as part of their daily practice, because that helps us in a number of ways. About the other alternative systems which are available in our country, I think it will be, they are also being used a lot. We know that the Ayurvedic system or the homeopathic system or other Unani systems, they are in vogue. But I have no problem with them, as long as the person is comfortable and person is deriving some benefit. In fact, sometimes my patient would ask me, Dr. Saab, I'm also taking homeopathic medicine for this. So I said that as long as you are okay, your homeopathic practitioner is okay with this, I have no issue. So the value or the role of those systems, we cannot underestimate. they have a role and they must play that role. And I'm sure that it is not just alternative in the sense that because we are not able to provide what you are saying, Western medicine or the modern medicine, but in their own right, they have that value. And some people are great believer. In fact, they would always go to such practitioner first, then seek any other help. So, but sometimes it can also cut the wrong way. But otherwise, yes, they have a place and they must prosper.
Well, a final personal question, and that is that what do you do to keep sane and your equanimity and smile and to keep continuing to deal with so much suffering that comes to you? And what is your method?
I come to you, Rajiv. uh, talking to you has always been a stress buster, and I have always enjoyed that. So
That's a curious answer. I
I would ask you to answer this question. That what do you do? Because I have always admired your laughter, Rajiv.
Oh goodness, I think we'll have to wind this up very quickly, lest my complexion changes with all the blushing that I. But thank you very, very much, Dr. Khandelwal, for this amazing evening of learning, and it, I think, sets the framework because unfortunately, and I do feel it's unfortunate very often, that we do live in a dominant Western paradigm of understanding the mind, and that tends to dominate it. But there are these layers and layers of possibility, which we hope that the 8 or 10, the series of 8 or 10 programs that we plan will unfold. And so at our next session, we will have Professor Hani Oberoi, who's a professor of human sciences at Ambedkar University. I'm told one of the few fully accredited psychoanalysts. So we'll be looking at another facet of the Western approach to healing the mind. But Dr. Oberoi has done some amazing work with the Tibetan community in India, and with a deep interest in their approach to developing resilience while in exile and under the brutality of the Chinese in Tibet. And so we look forward to how that will continue to this process of educating and illuminating us. And so that will be on the 4th of February, Friday at 6 o'clock. And meanwhile, a very earnest request, because I mean, just a personal aside, whenever I go to His Holiness and I say, shall we do this? Or what can we do? And his reflex response is, find out what is useful and do it. And so we really, really need your help and seek your help in your feedback as to what is it that we can most usefully do. And I think that there is a desperate need for many initiatives such as those that we are seeking to attempt. We obviously can't sit back and abdicate responsibility to public policy. I think we are being very seriously let down by that, with a few exceptions like Dr. Khandelwal. Yes.
One question to you, Rajiv, that I would like you to dwell a little bit, because you are expert in that, about the role of spirituality in such times. These are the times, uncertain time, people have felt very lonely, and they do not know. And as you said, that there is a vacuum from the top. And when we are not getting the right kind of, but we are being advised all the time about the spirituality and what it can do. So can we have few long or brief answers to this about the role of spirituality in such times?
Well, since this is not scheduled, but a very brief response to that, and I'm hoping that the that the series will unfold with greater detail. And I think that it really has to do with the India's civilizational heritage that enables us to train our minds to move beyond the purely reflex responses. And this has bearing on the Western idea of neuroplasticity, that you can, by familiarizing yourself through meditation of certain thought processes, change the biochemistry of the brain. And so it also offers specific insights and practices, for example, on uncertainty, to dwell on the idea of impermanence, that everything is constantly in change, is changing. So to rather than just respond to the particular stressor of ambiguity during COVID, to be able to spend time reflecting on the fact that everything changes, everything is in a constant change of flux, everything is impermanent. So we develop a kind of intellectual matrix of explaining that from different dimensions and perspectives. So, we remind ourselves that even Mount Everest, grows by 6 inches or whatever, 2 inches every year. The continents drift. So at a macro level, the little things happen. And then if you're as old as I am, then you look back and say, well, that was me. I have changed. What has changed? What element of me has changed? What is constant? So to build up a kind of dialectic process, which is then reinforced by practice. So both in terms of feeling and intellectual reason and logic, to be able to persuade oneself about the true nature of reality. And so in some ways, everything that is happening is really an expression of the nature of reality. And it's because we misunderstand it or we don't engage with it sufficiently that we struggle. But having said this, and this is just a very brief aside, is that His Holiness would also remind us that each one of us have a different mental disposition. So a particular worldview that would impact and make a difference to me, which would be, essentially compassionate and agnostic, but it is equally valid for someone who believes in a God, and the understanding of God's will helps them explain what is happening. And so I think the challenge that comes with much of the Western approach to this is that it tends to look at individuals as homogeneous and in very sort of clinical parameters. And so the essence of mind-body medicine, and so I don't know, if there was another context, I would ask you that within the 15 or 17 salts that psychiatry has available today, is there, I don't know, the most commonly one you hear about is Prozac. Are the different salts geared to particular individual biochemistries? Can you decipher that? And as you had mentioned, that it is may be beginning to happen. I was reading an article when I was sort of reading around this, that now somebody in California, does the brain scan, and then is able to predict what antidepressive drug might work. So instead of an intuition, there is a point. So whatever works, and to have the humility, and that's why I celebrate you so much, to be able to acknowledge the limitations of one's approach, the value that different approaches have to different people. And so that is our effort in this enterprise, is not merely to project our view or a view, but diverse views so that we can learn from them. And thank you for the opportunity of learning that you have given us, and most of all, for getting me to blush in public.
Thank you, Rajiv, for giving me the opportunity. In fact, it was a learning experience for me also. That what are the dimensions of this pandemic? It is futile to see it only as just a biological thing. that there is infection and there is treatment. I think the pandemic has focused our attention to very large canvas of all the uncertainty, loneliness, the community response, the spiritual response, alternative medicine, and yes. So thank you very much for giving me this opportunity for this interaction.
Thank you. And we hope you'll stay on board with us during the coming weeks.
Sure.
Thank you, everybody, for being a part of this, this mutual learning. And please, please, please send us your suggestions, your thoughts, or your ideas, because we desperately want to respond to what you consider will be useful. Thank you, and good night, good morning, good afternoon, good evening, wherever you are.